Hi, Mark at Physical of Eversville, and today what I want to share with you is I am 9 days post-op of a rotator cuff repair and bicep repair. So I figured I'd take this time then to tell you my experience with this, and hopefully it's going to help me to be better with other patients that have had this thing now, since I'm actually going through it myself. I've got a whole new appreciation for the pain that patients go through and their lack of being able to do anything that they want to do, including sleeping, after having this. So what I want to do today is talk a little bit about that, talk about some of the things that you should and shouldn't do, and what I'm learning practicing on myself, how to move, how to take a sling on and off. So I think the first thing that's important to know is that after you go through a surgery like this, typically it's the first 6 weeks that are the most critical as far as when it's most easy to tear up your repair. And no matter how good your surgeon is, they can never do as good a job repairing something the second time as what they can the first. So I've been lectured to extensively by my mom, my brother, my bride, about not being an idiot with this thing and taking my time with it. I think that from what I went through already that first week, I don't think that'll be a problem. So what I want you to understand is all the different physicians, a lot of times they have different protocols for you. So priority number one, follow what your physician is telling you. My physician, I'm going to be in this sling for 5 more weeks, or a total of 6. I can't move it myself. I'm allowed a little bit of passive range of motion only. So a lot of times people get confused on that. So that's what I want to define for you. Passive range of motion means that someone is taking the joint that you're moving, in this case to be my shoulder joint, and somebody would move that for you without any help from the patient at all. So you are not trying to contract or use your muscles at all. You're trying to stay as limp as you can, which is one of the hardest things to do, is relax when somebody else grabs a post-surgical shoulder. Okay? So that's passive range of motion. You aren't allowed to raise it. So what I'm not allowed to do, I can't try to raise this arm defined as from my elbow to my shoulder from my side on my own. The next step is going to be what they call active assist range of motion. And that is where you can use something, a pulley, a bar, but you can actively help yourself as you move it. So I can use the muscle a little bit while I drive it with something else, in this case the other hand, to get motion. So nice and easy. That would be your next step. That will happen with me in 5 more weeks. Then the third way, our third type of motion, is active range of motion, and that is where you can actively move, in this case, shoulder joint on your own without assistance. So the first thing you need to understand is the different types of motions and what you're allowed to do and what you can't do. To reiterate that, what I can do is I can actively move my wrist up and down. I can actively squeeze. I can bring my arm out of this sling at the side, and I can actively bend and straighten my elbow. Those meaning I can do it on my own without resistance. But my shoulder joint can only be moved gently without any type of assistance from myself. So I'll go into a couple other techniques in the next video. If you have questions, contact us at physicalofersville.com.